glaucoma, which first affects peripheral vision, age-related macular degeneration, abbreviated as AMD, affects central vision. AMD is the third leading cause of blindness in developed countries, especially in people older than 60 years, accounting for around 8.7% of blindness worldwide. For this video, let's discuss age-related macular degeneration, its symptoms, pathophysiology, and risk factors. That's it this video. Let's take a look. Hello everyone, welcome to my channel, and today we are talking about macular degeneration. This channel is dedicated to providing you with the most informative and up-to-date eye health information. If you are new here, consider subscribing. Also, if you have any general questions about the eye, you can leave them in the comment section below and I will answer them when I have time. Just FYI that as I am not a licensed eye health professional, I am not allowed to give professional medical advices. The macula is an oval-shaped, pigmented area of the retina at the back of the eye. This is a photograph of a healthy eye fundus, and at the center of the macula is the fovea. The macula, especially the fovea, is particularly rich in cone cells, which are responsible for color vision and color sensitivity. Hence, the macula is responsible for the central, higher resolution, color vision that is possible in good light. In macular degeneration, the photoreceptors on the macula die off and results in a slow loss of vision. Patients will first experience blurred vision, and as the disease progresses, patients start to notice a blind spot slowly enlarge over time at the dead center of their vision. Also, due to the loss of cone cells, colors become less vivid and darker. Macular degeneration can be very challenging for patients because the blind spot at the dead center of the vision affects their ability to read and distinguish faces. Imagine holding a book in front of you and you just can't recognize the letters on it. Yeah, macular degeneration can severely harm patients' quality of life and can be extremely debilitating. Age-related macular degeneration occurs in two forms, dry and wet. While this video focuses on macular degeneration related to aging, keep in mind that younger people can develop other forms of macular degenerations, some inherited and some acquired, which may show similarities to age-related macular degeneration. Examples will be Best's disease and Stargardt disease. The human retina is divided into 10 layers, and underneath the retina lies the retinal pigment epithelium. Below the RPE lies the choroid. Choroid is further divided into 4 layers, and the Bruch membrane is the innermost layer of the choroid. In dry macular degeneration, eye fundus examination reveals a buildup of a yellowish subretinal deposit called drusen. Drusen are extracellular waste products lying between the RPE and the Bruch membrane that are not properly cleaned up by the body. Excessive accumulation of drusen deprives the RPE and the photoreceptor cells of oxygen and nutrients. Over time, dry macular degeneration leads to scarring or thinning of the retina above. The presence of a few small and hard drusens with definite boundaries is a normal part of aging, but more numerous and larger drusens usually indicate development of early-stage macular degeneration. When one progresses to the late stages of dry macular degeneration, which happens very slowly, drusen begins to disappear, but at the same time, the macula shows an oval area of depigmentation or absence of the RPE. This means that part of the retina has atrophied and one can directly view the choroidal vessels. The atrophic patch is called geographic atrophy. Geographic atrophy will enlarge over time and it tends to be bilateral. Patients will notice a large scotoma or blind spot at the center of their vision. Unfortunately, when one progresses to the late stage of dry macular degeneration, there is no way to bring one's vision back because lost photoreceptors cannot be regenerated and patients will have to live with low vision for the rest of their life. Around 10% of patients with dry macular degeneration will go on to develop the wet form of the disease. In wet macular degeneration, signals protein called vascular endothelial growth factors are released and stimulate the growth of abnormal blood vessels originating from the choroid. Since the bridge membrane, the innermost layer of the choroid, becomes brittle due to the degeneration, the abnormal blood vessels penetrate the bridge membrane and start to grow like tentacles into the retina, often toward the macula. The growth of abnormal blood vessels from the choroid to the retina is called choroidal neovascularization. The problem with these blood vessels is that they are kind of like leaky garden hose. They are fragile and constantly leak fluids and blood into the retina, which damages the structure of the macula. The result is scarring and significant vision loss. In extreme cases, blood can seep into the gap between the retina and the RPE, causing the retina to separate from the back of the eye. And we call this a hemorrhagic retinal detachment. Because hemorrhagic retinal detachment caused by AMD is always accompanied by thinning of the RPE and atrophy of photoreceptors, the visual prognosis is usually extremely poor. Patients with wet macular degeneration will have blurring of their visual acuity and a blind spot at the center of their vision, which happens in matters of weeks. Due to the leakage of blood vessels damaging the structure of the macula, patients will notice distortion in size and shape of objects, and we call this metamorphosia. In comparison to dry macular degeneration, wet macular degeneration is much more progressive and likely to cause severe vision loss. Over 2 to 3 years without treatment, 50 to 60% of eyes with wet AMD and subfoveal CNV will lose 6 or more lines of vision. However, while wet AMD can severely damage central vision, it does not affect peripheral vision, and people do not go completely blind from even the most severe forms of the disease. The earlier you catch the progression to wet AMD, the greater the likelihood of successful treatment. That's why it's important for everyone with dry AMD to get in the habit of checking their central vision at home at least once a week. A good way to do this is with the Amster grid test. You focus your eyes on a central spot on the grid that resembles graph paper. If the lines near the dot appear wavy or are missing, you may have AMD. You can simulate this test by looking at window planes or floor tiles to see if the straight lines look wavy. If you already have dry AMD, it's a good idea to perform this test regularly to check for signs of progression to the wet form of the disease. Distortion on the grid may be a sign of wet AMD, especially if this distortion is new for you. By then, you should refer yourself to your ophthalmologist. Alright, I think this should be a comprehensive overview on what age-related macular degeneration is. And before the end of the video, let's shed some light on the common risk factors of the disease. The number one risk factor for age-related macular degeneration is, of course, aging. Figure in 2010 shows that in the United States, AMD affects around 2% of people over 50 years of age. The risk is, however, jumps to 30% at age 75. The exact relationship between aging and macular degeneration is complicated and beyond the scope of this video. If you are interested, then in the future, I can make another video talking about the structural changes of the retina with age. But for now, just remember that older you are, higher the risk. The second big risk factor for AMD is smoking. Smokers are up to 4 times as likely to develop AMD compared to those who have never smoked. Smokers also develop AMD up to 10 years earlier than non-smokers, and their AMDs progress faster and are less responsive to treatments. Many of the 4,500 chemicals in tobacco smoke are extremely toxic. For example, smoke contains arsenic, formaldehyde, and ammonia. These chemicals travel to the back of the eye through the bloodstream and they damage the structure of the retina. If you smoke and you are already showing symptoms of early stage AMD, you need to stop. Quit smoking is not only beneficial to your eye, but also to your health in general. The next risk factor for AMD is female sex. Women get this disorder much more common than men, but possibly because they live longer. Then we have race. White people have the highest risk of developing age-related macular degeneration, followed by Chinese and Hispanic people. African Americans are least likely to develop the disease. About a third of Caucasians have genes linked to AMD, and they usually have lighter eyes compared to African Americans and Asians, meaning that their eyes don't deflect light rays as well as dark eyes. Furthermore, white people develop more progressive AMD and are more likely to go blind from the disease. There are also other risk factors that might increase your risk. They include coronary artery disease, unprotected exposure to bright sunlight and ultraviolet radiation, family history of AMD, farsightedness, high blood pressure, obesity, and sleep apnea. There has been some question as to whether cataract surgery may play a role in the development of AMD, mainly because many older adults have both conditions, but research hasn't supported this idea. Last but not least, you should know that there is a link between diet and AMD. Studies have found that AMD is more common in people whose diets are deficient in vitamin C and E, the mineral zinc, and lutein, and zeaxanthin, which are substances known as carotenoids found in green leafy vegetables and fruits, and they are the dominant pigments in the macula. A diet high in refined carbohydrates, saturated fats, and sugary foods may also raise the risk of AMD. Alright, that's it for today, guys. Thank you for watching. Although AMD is not curable, early detection and treatment can prevent damage to the retina. For this reason, it's crucial to have regular eye exams because all the available treatments for wet AMD work best in the disease early stages. If you like this video, give me a thumb up and consider subscribing. If you have a family member over 60 years of age and they haven't had a comprehensive eye exam in the past few years, consider taking them to an eye clinic. Prevention is better than cure. Take care of yourself and see you next time.